This is my daughter, Maddie. And first of all, thank you both for sharing your stories. I am so sorry that you've had to go through that. And cervical cancer is a horrible, horrible thing. But I have to say, I do not think Gardasil is the answer. My daughter, Maddie, received the shot 4 years ago, and our lives have been hell since she received these shots. 6 days after, she started passing out. 10 days after the third shot, she started losing her mind. I have sat in front of my child over 100 times, and she has no idea who I am. And this will last an hour. It will happen 4 or 5 times a day. We've been everywhere. Dr. Brown, I've contacted you and said, please help us. We just want answers, we want cures. She has gone blind. She loses her hair in chunks. She breaks out in rashes. She has muscle pain where she cannot move. And these seizure-like episodes are the absolute worst. She can't drive. She was a varsity soccer player, varsity basketball player, high honor roll student, cross-country runner, never sick, ever. She got these shots, I didn't think anything about it, and now no one can help us. What do we do? Where do we go?
Well, obviously, if you've experienced, yeah. And I would, so that, horrible things happen to people, and we all want answers. When it happens, if it happens to someone in my family, your family, anyone's family, you want answers. Sometimes the answers aren't there. Now, you tell it, your story is very heartbreaking and very compelling, but I'm reluctant, and I understand how you would.
If I may, I know what you're going to say. We have
well, allow me to say it, okay? Before you, and I understand you have a point of view, but allow me to say it. Because something happens after something else doesn't necessarily mean that it's caused by that previous thing. And the problem is it's very difficult to determine what, when B occurs, what causes B. Is it a particular A event that occurred before? It's really difficult to tell. There's no way to tell with any one person. And that's why there are these huge studies. And when you look at the huge studies, you're in a much better position to figure out, is there an actual causal link? With one person, you're talking about a tragedy that may be impossible to figure out. And so the one thing I would say is I would challenge your 100% firm conclusion that this is the vaccine, because there's no way to determine that with any one tragic event like the one you're talking about.
Well, the doctors that we have seen here around Indianapolis that do agree with us, but they're scared to go public with it, have said to me, and this is a horrible thing to say to a mother, one Maddie is not enough. Meaning, because Maddie, who is a totally healthy child one day, and a zombie for weeks, 4 years we are talking about. We have been dealing with this.
I'm really in no way, I understand that, and I'm in no way trying to minimize the heartache and anguish that you've gone through at all. I mean, I understand that. But but again, for every doctor that you say will support you, I'll find 1,000 or 10,000 who will stand up and say it's not the vaccine. And these are all doctors that are all like Dr. Brown, who really know this field. So I mean, that's the, again, I'm not trying to minimize what you've gone through, but I think it's really important that we don't take our own personal tragedies necessarily and then generalize and say, well, this is the vaccine that caused this, because
but they can find no other.
I know.
We've been to immunologists,
Absolutely.
Cardiologists, neurologists, psychologists.
But sometimes bad things happen and we don't end up finding out what they are.
Well, we did unfortunately have to file with the Vaccine Compensation Fund because this has taken everything from us.
And that's absolutely.
And the medical experts have agreed with our claim. And we are going to trial, which I hate. I don't want to do that. And
you have every right, and that's what the Vaccine Compensation Fund is there for. You have every right to go to the fund and to seek compensation.
And they searched every record from the day I became pregnant with her, and they are certain. And the VAERS report also is not easy to file. You have to provide every doctor, every test, every facility, address, phone number. It's not easy.
Talk about.
And to date, there are 24,185 adverse reactions and 108 deaths.
Well,
severe
again,
reactions.
as Dr. Brown pointed out, and as I pointed out, over 96% of those reports are for mild adverse events like soreness, like mild fever, like dizziness that pass very quickly.
I personally know 140 families that are dealing with
Again,
this.
the best way to determine
Every week
whether...
I hear of a new family.
Yeah, and actually we are going through that. So my
I'm
daughter,
Okay, well, yeah.
141.
Yeah, well, all I can...
We just
so-
want answers. We don't want
I
arguments.
understand you want answers, but
Cervical
what I'm
cancer
saying...
is
but
horrible,
what
but
I'm
what do
saying-
I do with my daughter?
Yeah,
She
no,
wants to
I-
go to college, she
right,
wanted to
and
be
I
a
can't-
neurosurgeon, she can't be a
can't
pilot,
answer-
she can't skydive,
Yeah,
she can't drive a car.
no, but,
What do I do?
yeah, well, I don't have the answer for that.
No,
and-
you don't.
and- But that doesn't mean that we then demonize the vaccine. And that's all I'm saying, is that based on all of the studies that have been done with hundreds of thousands, tens of thousands, hundreds of thousands of individuals, there is no support for blaming the vaccine for
Yeah, but
these
even
kinds
if
of
you have
events.
one case or 2 cases, you need to review, do more research.
I
They
can
do
bring
review.
them
They
out.
do, but they do
It's
review.
gonna be
They do
happening
review.
a lot of people.
No
They
one
do review. You
contacts
cannot
me.
generalize from
Yeah,
1
but-
or 2, even 10, or even 100 people to assume that this is what's going on when there have been this many tens and hundreds of millions of doses that have been administered
Yeah, but if
worldwide.
it's one person is affected with the vaccine, you need to look at
But-
it, do more
and-
research. Even one
and they're
person,
looking.
because the life is not your daughter, it's my daughter, it's her daughter, that you need to
Yeah,
look
but you're
at.
making the assumption already that it's the vaccine that
Oh,
caused
yeah,
it.
yes, because
And,
Yeah,
and the best
that's
research and the best evidence
it's
out
not an
there.
assumption, it's just happened just right after.
That's
So
why
it's
they
a
only give
coincidence.
one
Yeah.
vaccine
It's not a
because they
coincidence.
start
It's not a
suffering
coincidence.
and they don't finish the
But that's a definition of coincidence.
We'll take a comment from Laura Patterson in the back.
Even if, yeah.
Hi, I'm Laura Patterson, and yes, I do work for Marion County Public Health Department, and yes, I do work in immunizations. And I can speak to your grief, and let me tell you how. I have a daughter, Brittany was 6'4", she played post, basketball, she was a shooting coach for Rick Mount. She was going to college, she was the president of SAD, she was in National Honor Society, she was a captain of the soccer team. In October of her senior year, my daughter came into the office and got a flu shot. Every year that happens. Sunday, she started having problems talking. She lost her voice for about 8 weeks, her hair was falling out. She couldn't say anything. They did a bunch of scopes and they tried to, I don't know, put some electric shock thing going on in her throat so that she could at least grunt and make noise. She was tired all the time. Positive thing is that she began to get a bit better. And come basketball time, when they began playing real games, she actually was able to set a pick. However, come sectional time, my daughter lost her voice again. My daughter lost her voice for 8 months. Completely lost her voice. Her hair fell out. She couldn't go to school anymore. She would get dizzy. She had muscle aches. As a matter of fact, it ended up causing my divorce because my husband thought for sure she was crazy. If I had not been in the job that I'm in, trust me, I would have blamed the vaccine. I couldn't believe that everything that my daughter was being taken away from her. She couldn't talk all through the summer. She couldn't go and be a shooting coach for Rick Mountain. Oh yeah, by the way, she couldn't also play basketball in college, and darn. Then she did go to college even though she couldn't talk, and she started having tachycardia. She had to drop out of college. My daughter gained weight very quickly. Even at her height, she weighs about 280 pounds. Today, they argue back and forth. It depends, and I know the aches of going to doctors because we went everywhere, and I swear most of those doctors looked at me like, I know, you're just that kind of mom. You want me to say your daughter's sick. It made me crazy. Today, They go back and forth between chronic fatigue, lupus, whatever. I am so way not minimizing. It continues to break my heart. It totally changed the course of everything in her life, only 2 days after getting the flu vaccine. But I know it wasn't the flu vaccine. It just happened to happen at that point. And I have to feel somehow, some way, that, well, she's gonna know what she went through is changing the human being she's becoming. And I can't fix it. And as a mom, I've got to say that's the worst feeling, is not being able to fix it. I do totally understand, more than you know. But I believe with all my heart, truly, that flu vaccine did not cause that. My daughter still gets the flu vaccine. And God bless you, because I know.
I would just like to say that I do feel the pain that you all are going through, you know, as a parent and as a healthcare professional. I am a nurse practitioner who watched a 27-year-old cousin die last year from cervical cancer. She left behind 3 young children. 2 of them were young daughters, and I personally have an 8 and 10-year-old, a son and a daughter. And I think that, you know, seeing someone go through this death as Mr. Forbes and Mrs. Forbes did with their daughter, and you see what a terrible disease it is, that in those instances, when you have a vaccine that we are being told is safe, I am a health professional, as I said, so I do read all of the journal articles, all the evidence-based medicine that comes out that tells us that this vaccine is a safe vaccine. I do encourage my patients of all ages to get the vaccine. And if it were any type of vaccine that I feel like were for any other cancer besides a female cancer, it would be required in this country. And I strongly believe that, and am quite appalled that we aren't closer to making it something that is a required vaccine, because we know it can prevent cervical cancer. And I would just like, you know, wanted the opportunity to say that I've been on both sides of it, and not that that lessens what your children are going through, but we also have to realize that we're in this for a reason, and that's to prevent cervical cancer, to prevent women from dying from something that we can prevent through the education and the vaccine programs.
Thank you. I'd like to again thank all of you for taking time to join us tonight. This is just the beginning. Obviously, this is a topic of discussion that has lots of questions still around it, and that's why several of the organizations who came together to put this event on for you will be continuing to meet and talking about the questions that have been posed tonight, but ultimately about how we can improve access and affordability of this vaccine so that we can protect more Hoosiers. So I encourage you all to definitely visit the vendors who are with us tonight. We have folks from Cervical Cancer Free Indiana, the Indiana Family Health Council, the Indiana Immunization Coalition, the State Department of Health's Breast and Cervical Cancer Program, the Kristen Forbes Eve Foundation, our friends with Little Red Door Cancer Agency, Marion County Public Health Department, and the National Center of Excellence in Women's Health. All of these organizations have information on this topic, as well as information on where you can go to actually get the vaccine, and even at a reduced price. So again, thank you so much for coming, and again, this is a topic that we'll continue to explore throughout the state.
I just want to add one other thing. We're very interested in this issue, and we're very interested because of the impact that it's had on your family. So we would love to have any family that has a child that they feel have symptoms related to this vaccine. We'd love for you to be able to tell that story and report it to our Marion County Public Health Department. We'd like to be able to really document the number of people who are having these symptoms and what type of symptoms that they have. We do have epidemiologists. We want to look at any trends or any patterns that people are having these similar symptoms, because things can pop up related to certain vaccines, and sometimes you may not find out about it until a later time. So please contact our immunization program. My name is Dr. Virginia Kane, Director of the Marion County Public Health Department, and we will start to try to capture this information and see if we have any numbers related to it.